Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss about the role of family members in mental illnesses. In mental health conditions, the role of family is very crucial because many a times we see that because of the mental illness, the family members are also overburdened and they feel very frustrated. A lot of times we get to see that because of chronic mental health issues in a particular individual in a family, that particular person cannot even function properly in his day-to-day life, and as a result of which he needs to be assisted in his day-to-day activities. He stops earning, he just lies down in his bed, and sometimes he becomes a burden to his family. As a result of this, he can become a true burden to his family sometimes, or he's at least perceived to be a burden to his other family members. They feel they have to spend a lot of money on him because of his treatment. Sometimes they feel that he's not being able to contribute financially to the family, socially to the family, etc. As a result of which, we see something which is called expressed emotions. Expressed emotions can be both positive and negative. When we talk about positive expressed emotions, sometimes we get to see that some family members of mentally ill people, they actually sympathize with the patient a lot. They feel sad for the patient, they feel sorry for the patient, and they start helping the patient more than he actually deserves, or which is healthy for him. For example, they don't allow the patient to live an independent life. They help him take bath, they help him eat his food. They do everything for him. They think that by showering their love and affection on him this way, they're actually helping the person to recover soon, which is not true. On the other side, there can be negative expressed emotions, which means that sometimes family members can be so overburdened with the responsibilities of a mentally ill person that they start rebuking the person, they start ignoring the person, neglecting the person, so far his food, his daily needs are concerned. Both these attitudes are wrong. Increased expressed emotions not only worsens the prognosis of mental illness, it even leads to frequent relapses in mental illnesses. Therefore, you must always, as a family member, help a mentally ill patient who's a member of your family to live a normal life, as normal life as possible. Allow him to be independent. Assist him in activities that he needs assistance in, but do not go beyond, and please don't neglect him. Because mental illness is just like physical illness, and this person is not responsible for his mental illness. Sometimes there are myths associated. People think that depression is because a person's willpower is less or mind is weak, which is not true. Nowadays, it is proved that depression, anxiety, and all other mental illnesses are primarily because of biological, biochemical, neurotransmitter imbalances in the brain. And so this needs to be understood that it is like any other physical ailment which requires treatment in the form of medications or psychotherapy. Apart from this, sometimes we get to see a lot of adolescents and children, and then we come to know from them when we counsel them that there was a lot of family dysfunction which actually makes them behave the way they behave finally. Adolescents and children who come to us with problems of poor scholastic performance, hyperactivity, anger issues, or demandingness, etc., when we properly talk to them, many times, in majority of these cases, we get to see family dysfunction. So family counseling also becomes very, very necessary. A lot of myths are associated with psychiatric problems. A lot of family members are not aware that psychiatric diseases are actually diseases or disorders. They feel that, they think that it's because of some curse, or it's because of ghost, it's because of sins, etc., which is not true. Only if they become aware of mental health issues can they actually take proper care of a member who's not mentally healthy. Apart from this, family needs to be given psychoeducation about the cause of mental illnesses, the signs and symptoms of mental illnesses, because many times they do not even bring the patient to a doctor till the disease has progressed too far, because they initially do not know if the person is just behaving like that because of mood swings or it is the beginning of a mental illness. Now, sometimes they even stop treatment in between when the patient responds a bit to treatment because they think that the rest can be managed by willpower, which is not true. So, every family member must know that compliance to treatment is very necessary for recovery and relapse prevention. Sometimes we do understand that family members go through a lot of stress and strain because of a mentally ill patient in their family. For them, we offer family counseling, and if required, we can also give them medications for a short term, provided they cooperate with us. So, psychiatric disorder or disease does happen to a particular individual, but it sometimes affects the entire family. Therefore, in our treatment approach, we have to address family issues together with, parallelly, with the treatment of this particular individual. Do remember to like this video or subscribe this video, and we promise to come back with another interesting topic. Till then, take care.